I'm doing good. How are you doing?
Good. I'm doing well. Why don't you go ahead and take a seat and
Hmm.
I'll discuss this treatment plan we've kind of come up with you. And we've also come up with the diagnosis and a little bit of a plan to get you better.
Alrighty.
Okay. Well, we went ahead and diagnosed you with having spondylolisthesis. Have you heard of this before?
I have not.
Okay. It's basically a condition where your bones in your lower back, one of them slips forward over the bone below it. And
Hmm.
this can kind of
Mm.
so it out. It does seem chronic and it is more moderate, so it's not as severe.
Mm-hmm.
But we've come up with the treatment plan, and we do have a couple problems we're kind of anticipating to complicate the treatment plan a little bit, um, such as working on your posture and your sedentary job. You maybe not moving around as much as an accountant
Mm-hmm.
um, and sitting all day. That posture doesn't necessarily help and can contribute to having spondylolisthesis. So,
Mm.
and this inconsistency basically can make it a little difficult to, start an exercise regime due to your, work schedule that you said that you do work so much.
Yeah.
Um, if we can kind of work around those things and you can be conscious, we've come up with a couple therapies and things we can try to strengthen some muscles to help some of your posture. So, does that sound okay?
Yeah. Let's hear it.
Okay. So, basically, at the beginning of our treatment plan, we're going to begin with some chiropractic adjustments. We'll do about 3 to 4 regions within your lower back. And we're thinking we're going to do maybe 6 visits for about 2 weeks. And then we'd reassess and see how much those improved your posture and improved your pain.
Okay.
Um, yeah, the goal with that would basically be to kind of improve your spinal alignment, reduce that nerve compression, and help you be able to move around. Does that sound okay?
Oh yeah. I'll take it.
Okay. Well, then we came up with some therapeutic exercises to kind of try to strengthen those muscles around your pelvis and your lumbar spine. We would start with pelvic tilts. Are you familiar with pelvic tilts?
Not really.
Okay. Basically, you're lying on your back. Your knees are bent, your feet are flat on the floor, you're about hip width apart, and you're just bringing your abs up to the sky and kind of tightening your ab muscles. This will
Okay.
help strengthen your core and improve your lumbar spine and help with stability. But we do about 3 sets of those and 15 reps in each set.
Hmm.
Um, we have some other exercises we do, such as bridges. Um, we have bird dog exercises. For the bridge, you basically lie on your back with your knees bent, your feet on the floor, and your I'm sorry, I said that wrong. You're lowering your hips back to the floor as you're in a bridge position.
Okay.
We do this probably 12 times, 3 sets, each 12 reps, and this would basically strengthen your glutes and your lower back muscles. And again, all this is strengthening, the muscles around your hips. Um, Next, we would do some bird dog exercises. You would start on your hands and knees with your hands directly under your shoulders and tighten your abs and extend your arm forward while basically simultaneously extending your opposite leg back. Um,
Okay.
yeah, keeping both kind of parallel. And we do 3 sets of this, about 10 reps. And this would enhance your core stability and coordination again. And then we would do some planks. I assume you're familiar with planks.
Yeah, I've heard of planks before.
Yeah, basically have your forearms on the ground and you'll be holding position for about 30 seconds. And we'll do 3 sets of those. And this again will strengthen your core and improve your overall stability.
Cool.
Yeah, so do you have any questions? I know I've talked a lot.
No, no questions.
Next is our goals and our adjustments for our goals.
Mhm.
Basically, our goals for our adjustments. We do 6 visits over the 2 weeks, which I talked about earlier. And if we're having improvement, we could do up to 18 visits for 6 to 8 weeks. Our short-term goal, which would be the 4 weeks, would be to reduce the pain to about 4 out of 10 and improve your range of motion by about 20%. Then our medium-term goal at about 8 weeks would be to
Mhm.
reduce the pain from 2 to 10 and enhance mobility and function. And our long-term goal at 12 weeks would be to maintain pain at about 1 out of 10 or below, and you basically be able to, do everything you were doing in your daily living before you had the pain and before it
Mm.
began. Our goals for our therapeutic exercises would be 6 visits over 2 weeks. And if we're having improvement, we could do up to 18 visits for probably about 6 to 8 weeks. Um, our short-term goal would be to increase core strength um, and reduce pain with movement, and that would be about our 4-week goal.
Mhm.
Our 8-week goal or our medium-term goal would be to improve your posture and to increase endurance. And our long-term goal for that, about 12 weeks, would be to sustain improvements and prevent recurrence. So we use this auspice tree disability index, and it's our planned outcome. And our
Okay.
current score for you, categorizing your disability from your pain, is about 40 out of 100. And this would categorize you as severe disability. And
Oh,
so our target score at the end of all this is basically to improve that by 20% within 8 weeks. And so this would move that 40 to 32 out of 100 or less. Less would be great. But our long-term goal would be 70% improvement within the 12 weeks, and that would equivalent to about 12 out of 100 or less. Okay.
okay.
Do you have any questions about that?
Uh, Sounds like we'll make an improvement.
Mr. Robinson, we expect you to experience significant improvement in your pain levels, your quality of life, your functional capacity, your full range of motion. I think that with these treatments, they should be effective, and the adjustments, all of it is necessary. Does this all sound okay to you?
Yeah, sounds awesome.
Good. Um, well, I need to show you the consent form. Do you mind if I read through this to you real quick?
Sure.
Okay. So the first thing on here is chiropractic adjustment. Basically, what a chiropractic adjustment is we use our hands or mechanical devices to move joints around, which will make a pop or a click. I'm sure you know all this, but similar to cracking knuckles. And you may feel this kind of movement during the adjustment. There are risks with doing chiropractic adjustments. These could include fractures, dislocations, disc injuries, muscle strains. All these are very rare complications. Um, and minor side effects can include stiffness or soreness for a few days after the treatment.
Okay.
Um, these risks are very unlikely. Fractures are rare and usually do happen if they do to pre-existing bone weakness. The risk of a stroke from neck manipulations is rare and is continuously studied. We take many precautions to screen for contraindications, and other complications are generally very rare also. Do you have any questions so far?
No questions.
Okay, so you do have other treatment options. You can do over-the-counter pain relief and rest. You could take prescription drugs such as anti-inflammatories, muscle relaxants. painkillers. We get a lot of people that have already tried all these things before we see them. You can attempt to have hospitalization, have surgery performed. Each option kind of has its own risk and benefit. But if you wish to discuss another option, I would encourage you to go see a physician. Okay.
Okay.
If I choose, so if you choose to not be treated, adhesions can form and reducing mobility and creating a cycle of pain and further immobility. So things could get worse if you delay your treatment or complicate your future rehab, making it more challenging and ultimately less affecting. Making things more affecting. But let's see. I need you to read this area here and understand you do understand the information about chiropractic adjustments. Do you have any questions with me or risks or benefits you'd like to go over?
No, sir. Sounds like something I'm interested in.
Okay. All right. And I also do want to inform you of these additional treatments such as decompression, traction, thiothermy, cryotherapy, heat, ultrasound, cupping. They all have specific risks also and can aggravate or cause burns or skin reactions. But I wanted to inform you of these if you wish to attempt to try any of those treatments also. Okay.
Okay.
Okay. So you'll sign here, and this consent basically ensures that you're fully aware of the nature of the chiropractic adjustments, the associated risk, and other treatment options and their risk, and the consequences of not receiving a treatment.
Awesome. Okay.
Well, after signing that, we can move forward and get started on working on you. Do you have any other questions?
No, sir. Sounds like a plan.
All right. Very good. I hope we can make you better.
I hope so too.
Okay. Thank
All
you.
right. No problem. Did you